our brothers and sisters, Lidj, Yefdeyah here. We mentioned, and of course, I brought forward that particular subject matter from the outset here. Also to speak to our next point, our next topical matter, which we would love to bring forward. Now, of course, we have expounded a bit, just slightly, which we hope to continue, especially moving on, because this will be another one of the proposals we seek to bring forward, and really more so include as many, of course, within the co-laborship and the fellowship as we can on this particular instance. So as we have mentioned, of course, with this, or the turn of this new Gregorian year here in 2018, January 1st, as it marks the date. And of course, we are just leaving the first initial 30 to 31 days of the legalization of cannabis here in the United States, at least in certain pockets. We bring this forward in the sense that we mentioned to pay attention more to the issues that affect you, especially with this particular point, which we are bringing forward here. And, of course, the topic, of course, reads from the New York Times. As it mentions, the opioid epidemic, or the opioid crisis, coined a crisis years in the making. And this report actually stemming from October of last year in 2017. And, of course, we have the supplementary statistical data also to support what actually is being said here. And it mentions as such from writer Maya Salam from October 26, 2017, the current opioid crisis is the deadliest drug crisis in American history. It says a mouthful, especially from even the times of the crack epidemic. Overdoses fueled by opioids are the leading cause of death for Americans under 50 years old, killing roughly 64,000 people last year, more than guns or car accidents, or doing so at a pace faster than the HIV epidemic did at its peak. President Trump declared the opioid crisis a public health emergency on Thursday. This is, of course, October 25th, 2017. Though he did not release additional funding to address it, had he declared it a national emergency, as he promised to do in August, it would have led to a quick allocation of federal funds. The New York Times has been covering the outbreak from when it started bubbling up in towns around the United States years ago up until now, as it decimates communities and families. Here is a roundup of our best reporting on the epidemic, including short answers and also certain things that had come from the reports, especially from 2017. This is the New York Times on the opioid epidemic, written by Maya Salam, and to support the claims that she actually had made in this particular write-up, here from the CDC. The ones don't actually know what that is, or have heard it in passing, not so much as to inquire actually to what it is. The CDC is a government, or at least a federally regulated entity that is known as the Center for Disease Control. And they more so do reporting on such instances such as this, especially pertaining to health, sometimes within much of other aspects of demographics as well, so dealing with the people in and around the United States of America. And even so, the data shows and reflects as such as what we have here in front of us at least dates to 2014, the record of deaths from the data sources. And it reads, of course, here, opioids, a prescription or an illicit, are the main driver of drug overdose deaths. Opioids are involved in 42,249 deaths in 2016, and opioid overdose deaths were 5 times higher in 2016 than 1999. In 2016, the 5 states with the highest rates of death due to drug overdose were West Virginia, Ohio, New Hampshire, Pennsylvania, and Kentucky. Significant increases in drug overdose deaths rates from 2015 to 2016 were seen in the Northeast, Midwest, and South census regions. States with statistically significant increases in drug overdose deaths rate included Connecticut, Delaware, Florida, Illinois, Indiana, Kentucky, Louisiana, Maine, Maryland, Massachusetts, Michigan, Minnesota, Missouri, New York, New Jersey, North Carolina, Ohio, Oklahoma, Pennsylvania, South Carolina, Tennessee, Texas, Vermont, Virginia, West Virginia, and Wisconsin. And those, of course, would do themselves well to do much more research on this particular subject matter, as, of course, we will bring to the eye another report just adding to a lot of what we have presented before, just for our short bit, and also just the short rendition we brought forth from the last two RZ here in another report from the New York magazine in the Daily Intelligencer section. This one written by Eric Levitt. New Jersey governor vows to legalize weed or marijuana, cannabis. Cuomo promises to think about it. New Jersey is moving full weed ahead, quote unquote, toward legalizing recreational marijuana. In his inauguration speech on Tuesday, newly elected Democrat Governor Phil Murphy said that his vision for a stronger and fairer New Jersey includes up to legalize marijuana for cannabis as part of a broader package of criminal justice reforms. While Murphy frames his support for marijuana legalization primarily as a means of combating mass incarceration and racial disparities in criminal justice, there is also a fiscal component to his pitch. Excuse that. So in continuation, our brothers and sisters, we read on. By some estimate, a legal pot market could provide the Garden State with an additional $300 million in revenue by year 2020. Given New Jersey's pension obligations, myriad public sector needs, and already high property and income taxes, which are set to bite harder thanks to the GOP tax bill, the revenue argument for bringing the cannabis trade into the legitimate economy may prove the most salient. Earlier this month, Attorney General Jeff Sessions reversed an Obama-era policy that had enabled states to pursue marijuana or cannabis legalization without threat of federal interference, so long as they took measures to prevent reefer, the pungent, from getting into the hands of minors or criminal gangs. But Sessions' memo still afforded U.S. attorneys the prosecutorial discretion to leave dispensaries be. And for the moment, they appear to be taking a laissez-faire approach to policing the weed trade in the 8 states that have legalized recreational marijuana. There are pockets of support for marijuana prohibition within the Democratic-controlled state legislature. The former Governor Chris Christie had long been the primary obstacle to legalization. The president of New Jersey's State Senate, Stephen Sweeney, is a staunch supporter of legalizing cannabis. Sweeney's position empowers him to unilaterally decide which bills receive public hearings or floor votes, and the Senate president has vowed to put a pot bill on Murphy's desk within the next 100 days. Meanwhile, further up Route 9, New York Governor Andrew Cuomo took a more tentative step toward making wacky tobacco, quote unquote, available over the counter. In his annual address on the state budget on Tuesday, Cuomo implored lawmakers to fund a feasibility study which would examine the costs, benefits, and legal risks of legalizing the recreational use of marijuana or cannabis. This is an important topic, Cuomo said, and it would be nice to have some facts in the middle of the debate. Cuomo's proposed study would be conducted by the state's health department with the consultation of state police, a point he was eager to emphasize. The governor has previously expressed opposition to legalizing cannabis. It's a gateway drug, and marijuana leads to other drugs, and there's a lot of proof that that's true. Cuomo said last February. There's two sides to the argument, but I, as of this day, I am unconvinced on recreational marijuana or cannabis. Cuomo's decision to consider a change of heart is likely driven by the same combination of public opinion and budgetary pressure that's pushing the Garden State towards legal green. In November, a poll from Emerson College found that 62% of New Yorkers approved of legalizing marijuana for adult use. The survey also showed that taxing sales of legal marijuana, weed or cannabis, was a far more popular way of closing the state's $4.4 billion budget deficit than higher taxes, new tolls, or reducing education spending. Of course, marijuana tax revenue could not close that deficit by itself. Virtually every state in the union forces some kind of fiscal crisis as a product of federal disinvestment and rising public pension costs. Legalizing and taxing new vices is not a sustainable solution to that problem. But as Cuomo's study will likely find, the case for legalizing marijuana or cannabis is plenty strong, irrespective of its fiscal benefits. It simply does not make public policy sense to create an unregulated black market for a popular substance that is less addictive, less fatal, and less likely to cause traffic accidents than alcohol. Bringing weed into the legitimate economy would take a major profit source away from violent drug cartels, while allowing American cops to spend less time disrupting the lives of soft drug users and more time policing violent crime. In 2014, there were 700,993 marijuana or cannabis arrests in the U.S., roughly 90% of which were attributed solely to possession. Such arrests aren't merely a waste of law enforcement's time and resources, they also perpetuate racial bias in America's criminal justice system. White and black Americans use marijuana at nearly identical rates, but African Americans are nearly 4 times more likely to be arrested for possession of the drug. Meanwhile, the public health costs of legalization appear to be fairly minor. In Colorado, the rate of marijuana use among teenagers has actually declined since the substance was legalized. And multiple studies have found that when states expand access to legal marijuana, declines in painkiller abuse and related overdoses follow. If New Jersey is smart enough to figure this one out, it shouldn't take much longer for the Empire State to have its come to cannabis moment. And this report, of course, coming from the Intelligencer section of the New York Magazine, written by Eric Lidj. A very interesting one, just to say the least. Again, our brothers and sisters, of course, as I mentioned, the federally regulated study on the overdose of opioids in this particular country to the tune of 64,000 approximately, and that number is still being divulged as we speak, affecting mostly the eastern seaboard, the Midwest, and many parts of the southern regions of the southern states of the United States. But, seeing the effects of what has come to pass within regulation, so to speak, a quote-unquote prohibition, if you please, within much of the talks that are going on. And as we mentioned before, many of these particular studies and also the reporters from more accredited and more sought-after reports or newspapers or magazines, so on and so forth, that somehow have the reputation that seemingly is a lot more affected by much of the public and seeking to have a lot more space within the public opinion. We see that much of the healing ailments or the healing particular parts of the particular drug which we speak of, or as they say the drug, we say more the herb. It really has been a struggle even so to read most of these reports, our brothers and sisters, to even continue to bring this forward to the eye. But we definitely have to, take that chance to make sure that ones are armed and forewarned of many things, and such as these, that much of the elected officials here in this country and many other places, as well as we mentioned Canada, also many other places such as Mexico, as well as Uruguay in South America, Uruguay, as one would see it. They have taken steps to move a lot further. One speak of the Netherlands and other places of that such, but even so, we see a lot of things changing, just to say the least, within this particular world which we are living in. But more so, we have to take in more the educational facts of these instances and make sure that we are prepared in the best way possible, not only to help ourselves but those around us as well. And if we can extend, the healing arm, of course, of Jah Almighty and His creation, we should be good and just stewards of that whenever possible. So just to leave that on the table for ones of those, because we are definitely still working, and we're also finalizing at this point a proposal which we hope to send out to ones and ones so that they, of course, can get a read on it as well, and of course make the decision whether they would like to participate or assist in what we have at least planned from such a time, and also see how ones, of course, can deliberate and bring in other ideas if they actually have that to present or can formulate that in a timely manner. But definitely keeping a lot of things on the table as far as this turn of the new year come into play. And we most certainly are keeping ourselves in a very patient set of our mindset and a frame of a reference at this point, because we really are at a very peculiar time, especially here in these Western nations, just to say the least. But we have to be ever so vigilant to keep our sacred things sacred, but also not be so tightly gripped on so many things which actually could bring about the change within our lives, which we, of course, are seeking the blessings which Jah, of course, hopes to bestow upon us. So that definitely takes a lot of discernment. It definitely takes a lot of soul searching, as ones and ones would say. But we, of course, put this on the table and leave this on the outset for ones to research, of course, for themselves. As we mentioned, many of the affected areas here in the United States specifically. Of course, there are many other places as well, but we speak a little more on that, which we are more familiar with at this particular time, but also within the realm of the public opinion of many ones. And we find that very odd, and, well, not so much odd, but also, maybe even so refreshing to see that much of the public, sees things in such a decriminalizing manner, just to bring about certain changes within not only this particular country, but other countries as well. So, of course, our brothers and sisters look forward to much of what we hope to present moving into this particular new year, as well as many of the projects we hope to get off the ground and up and running, as they say. But a lot much more to come on this. We hope to present a little more, even so more, on these particular subject matters, especially as these. And also, again, leaving things on the table for ones to come in and share their ideas as well, or things they may have seen on the public square that, of course, would benefit us in moving certain things forward. So not too many particulars we're giving out at this particular moment, but we would love, just to have many more heads and hands on deck as far as moving forward what we hope to accomplish. So, of course, another short Selah moment here, our brothers and sisters. We give thanks for the eye's patience. Still a little more to get to within this time as this world continues to change. We indeed are ever so thankful, ever faithful, ever sure to our Creator, the Most High, Jah Rastafari, Yahweh Elohim, Yefdeyah, Allah. Give thanks. This is your brother Lidj.